Good morning, Sam. My name is Melanie Kessel. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Sam Peter.
And what is your candidate number, please?
My candidate number is 251070108.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What did you like least about your last job?
That's a tough question to answer. I've had lots of opportunities at City Hospital, and I work with some outstanding people. I guess if I had to pick one thing, it would be the occasional meeting that goes an hour longer than normal. I like to get stuff done and work with people, and that extra hour could have let me get back to a patient more quickly.
Tell me about a time you failed.
I once rushed a patient's wound dressing. In a hurry, I just wrapped the wound and failed to stick the plaster. Fortunately, we discovered the mistake while stepping out of the patient's room. I apologized and completed the dressing. But the patient and the bystander weren't pleased. I never made that mistake again.
Do you like working with a team?
I thrive while working as a part of a team because of my ability to adapt. I find that working on a team allows for the best outcomes for patients. Everyone has a different way of looking at a problem, and multiple perspectives can bring about creative solutions to issues. Also, working on a team motivates me because I enjoy celebrating the successes of others. Last, I feel confident in my abilities to work along as well.
Describe a time there was a miscommunication between you and a teammate. How did you handle it?
One of my coworkers struggled to communicate during the handoff period to begin her shifts. She would often tell me partial information about a patient's status. This leads to confusion and chaos. Eventually, I told her politely that they weren't giving me proper information at the shift change. She corrected her ways and even began writing notes for the handoff. I learned the importance of speaking up and being direct at that moment.
How do you address questions from a patient's family and friends?
I lead with empathy. I know that I need to give them the best information that I can. However, I try to make sure that I am answering them in kind ways, and I imagine myself in their shoes. Now, I know that I can't answer all of their questions, so I try to set boundaries and make sure I'm not enabling, either.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you.
Excuse me. May I know the patient's name, please?
You can call her Melanie Kessel.
Thank you.
Your preparation time is over. The role play will now last for about 5 minutes. Don't worry if I stop you when the time is up. Can you start the role play, please?
Hi, good morning. My name is Sam Peter. I'm one of the registered nurses working in the city hospital. I'm here to change Melanie Kessel's wound dressing.
Hi, good morning, nurse. I'm Melanie Kessel. You may please come in.
Thank you. How are you doing?
I'm all right. How about you?
Oh, I am great. Thank you for asking. So, shall we start the consultation?
Sure, why not?
That's great. It's been 12 days since your operation, so, could you please brief me about general daily habits after the operation?
Yeah, for the last 12 days, I was really stuck here in the home. I work as a waitress, and demand a lot of footwork. Also, I'll be continuously standing for a longer duration. So I take rest from work. Do some movements inside the house for meeting basic needs. In the kitchen, I use less footwork, and use a kitchen stool chair, instead of standing.
Good to hear that, you have managed quite well. However, I'm sorry to see that, you have post-operative Staphylococcus aureus infection, on the right large toe.
What do you mean by that, nurse?
Nothing to be much alarmed about, Melanie. Staphylococcus aureus is often called staph, is a gram-positive, round-shaped bacterium. Staph bacteria can spread easily through cuts, abrasions, and skin-to-skin contact. They are common germs that can cause a variety of problems.
It's my carelessness that results in infection. I should have followed the surgeon's advice. I consider it as a quite normal wound and pay less care.
Well, from your briefing, your post-operative habits seem to be perfect. The fact is that sometimes people get a post-operative infection, but it is not really their fault.
Nurse, I was diagnosed with type 2 diabetes recently. Will it affect my healing time?
It might be, Melanie. Diabetes can delay wound healing.
No, nurse. I need a quick fix to the toe. I need to get back to work at the earliest as possible. The antibiotics obviously aren't working. Also, my carelessness causes the infection too. Please do something effective.
Melanie, please be patient. I truly understand your situation. With proper wound care management along with antibiotics, your wound can be healed with much pace.
Nurse, please provide me some very effective wound care management.
Sure, Melanie. I'll help you with it.
So kind of you, nurse.
Your toe can be healed with proper wound care management. First, you should provide much attendance to dressings. A protective covering to the wound dressing can be worn while accessing the bathroom, walking, and while in the kitchen. If possible, the wound should be exposed to fresh air for a while every day. And daily exposure to the sun is very much recommended as it accelerates the healing process. Along with these practices, take the antibiotics as prescribed by the doctor without any failure. Also, accept the fact that you did not cause your own infection.
Definitely, nurse. I will follow your instructions. And of course, nurse, now I accept that I didn't cause my own infection.
I'm glad to hear that, Melanie. By the way, type 2 diabetics have the risk of circulation problems. In case of diabetic people, circulation slows down, so blood moves more slowly, which makes it more difficult for the body to deliver nutrients to wounds and sometimes a greater risk of infection.
Nurse, I know the risk of diabetics experience with blood circulation, but it will be helpful if I have a brochure on how to manage my illness.
Sure, why not? Here is the booklet that contains the details you are looking for.
Thank you very much, nurse.
It's my pleasure. Melanie, I'll call you back next week. Take care and get well soon. Don't hesitate to ring me if you need any help.
Sure, happy to hear that, nurse.
Bye, take care of your health and get well soon.
Thank you. That is the end of your OHE speaking roleplay. All the best.
Thank you.
Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.